Dentures are still a very common, restoration or appliance therapy that we do for our patients. The truth is that 25% of adult Georgians have dentures, basically, are edentulous in some way, whether it be like their upper or their lower arch, which is sometimes a high number that people don't think of. But so there's a lot of denture wearers out there, and so many patients, at the beginning start to think, well, gosh, a denture, that sounds like an awful way to to replace your natural teeth. And we find that we can usually help patients in that adjustment process and get them to where they can wear their dentures comfortably. Sometimes it can be a bit of a compromise, but from the standpoint of having it something that is retentive and stays in with confidence, we feel like we've been able to succeed with hundreds of patients over the years. What I always tell patients is that upper dentures typically are very easily to get accustomed to, whereas lower dentures sometimes can be a little bit more of a challenge to get accustomed to. So if we're going to do anything, we're going to try to maintain something on the lower, whether it be a few teeth, and sometimes we get into the discussion of placing a couple implants. It can actually be fairly simple to have a lower that snaps into place, because the alternative for a lower is just getting used to a denture that moves around just a little bit, and it's more about muscle memory than anything else. But it's been fun for us to be able to offer implants for patients who have had, say, like a lower denture for 5, 10, 15 years, and to be able to basically allow them to start snapping their denture in. That's a pretty cool thing for us to do.